Alright, hello. This is my 9-week post-op video of my L5-S1 fusion surgery, lumbar fusion surgery. Last time I did one of these was at 3 weeks, and I just found out that I had discitis from probably my first discectomy up until, well, my third week post-op appointment, or second week post-appointment. So for the last 6 weeks I've been on penicillin and rifampicin for that infection, for that discitis, and happy to say that I'm off those now as of a couple of days ago, and I had a blood test today to find out what my C-reactive protein levels are, which are the levels of protein when you have tissue damage or infection. So hopefully those are still relatively low, which means that the infection's no longer really there. My cat's come to say hello. So hopefully they're not there, and then that means that the infection probably isn't there anymore. I also had an MRI at my 8-week appointment, which was last week, which showed that there was a normal amount of inflammation, which is good. So if there was loads and loads and loads of inflammation, that would point towards there being an active infection, and there's not, so that is quite promising. Although the type of bacteria growth that I have apparently is quite slow moving, and so we won't really know until the 6th month post-op point, where I'll have another MRI, or if between now and then I have a lot more pain, then that's a clue that the infection's still going. In terms of my pain levels now, I am back at work, so I can go to work and that's all fine. I'm off all opiates at the moment. I am off paracetamol mostly. I might take it once a day, maybe twice a day if it's a particularly bad day. I'm still on gabapentin, 300 milligrams at night. Also Panadol, for any American people watching, is paracetamol. And there's a lot of talk about anti-inflammatories, NSAIDs after fusion surgery. I'm currently taking 200 milligrams of Celebrex a day, so a COX-2 specific anti-inflammatory. And I've actually been on that since 3 days after my fusion, up until now. So I've been on it for 9 weeks. I was also on it leading up to my fusion surgery for pretty much 3 months, I think, up to that point. So I've essentially been on Celebrex for 5 months now, and there's a lot of talk about it being bad for bone fusion or bone growth, which I raised that with my surgeon at my 8-week appointment. I said, should I be getting off this now? I get nerve pain in my left leg if I don't take it, so it'd have to be a pretty good trade-off if I were to stop taking it. And he said, the field is kind of trending towards the fact that the use of these anti-inflammatories doesn't really prevent bone growth. So at the moment, I'm still taking my 200 milligrams a day. I think over the next week or two, I might start to try and wean that back to 100 milligrams a day, and hopefully to stop it. But as I mentioned, I do get quite a bit of nerve pain in the left glute and the left leg if I don't take it, which points towards it, I guess, being a more inflammatory mediated nerve pain. I'm guessing after 3 surgeries in 3 months, I still have quite a lot of inflammation in that nerve root area, so I'll wait for that to die down a little bit more before I start to really try to wean myself off. My 8-week post-op appointment, I did have an x-ray. My surgeon said he couldn't actually see how well the fusion's taking hold. He said there's a lot of the putty kind of stuff that they put in there to induce bone growth looks a lot like the actual bone growth on an x-ray. So at this point, it's quite hard to tell what's bone and what's that bone-like putty type stuff. So he said that probably won't be clear until 6 months. maybe even a year, depending on how fast it's kind of happening. I was hoping for a bit more of a specific response to that, but it is what it is. Pain-wise at the moment, I feel like I'm quite mobile. Like I'm back at work full time, so that's good. And you know, I do notice it at work, but it's definitely not stopping me from doing my job. I just can't lift very heavy things, but you know, a 5 kilo bottle of chemicals I can lift, and that's no problem. I feel like I could lift more than I can. I just I don't, out of fear. And then sitting down, I can sit for most, like I can sit down like this is fine. I do have some slight pain in the back if I kind of move like that, kind of on the sides and in hips. And if I sit here for too long, I will get some nerve pain, especially in that glute region. If I bend forward like that at the hip, I get a little bit down the outside of my left leg. My left leg's the one that's been bothering me since the very beginning. So again, I'm not too worried about that, and it's less when I have my anti-inflammatory. The pain that really bothers me at the moment is from lying down. So when I go and I lie down flat on my back, I get some really bad pain in my back, kind of like as I'm settling, and in my right hip and leg. And in the last probably 2 weeks, I've started to get a bit of that in my left leg. It's not too bad. It feels more like, I guess, pins and needles down my left leg, and it goes numb slightly, ever so slightly. And this is only for about the 30 seconds or so it takes me to actually settle into the bed. But that pain in my right hip and the right leg sticks around for as long as I'm lying down. It's definitely nowhere near as bad as it was, and it is getting better. It's just much slower than I would like. And when I wake up in the morning, it's so much better. I feel like almost normal when I wake up in the morning and I'm lying there. I can toss and turn and it doesn't hurt at all. So that's really promising. It gives me some hope. But it does hurt when I get up. So like if I lie on the couch, for example, even on my side, and watch a movie or something, as soon as I get up, I'll feel that in my back, I'll feel that in my hips. And I can walk around. If I walk around for 10 minutes or so afterwards, then it kind of goes away. But yeah, it's not pleasant. It makes me not want to lie on the couch or sit on the couch or anything. And going to bed, it's nice to lie down and get off my feet at the moment. But again, it's not pleasant, at least for the first couple of minutes. At least it's not interrupting my sleep at all, so that's all I can really hope for. There's not many other updates. I'm still just doing general physio exercises, things like clamshells. I've tried to do bridges, but that pain in my right hip, when I'm lying down on the ground, I can't put any pressure through my right leg. So bridges are still off the table. And yeah, I've been told I can go back to using a stationary bike, but I don't feel like I'm ready to do that yet. I have to put the seat right down, and I'm going to stay away from that for the next couple of weeks, I think. And then I went swimming actually the weekend, just gently in a pool, and that actually felt pretty good. I get a few slight twinges in my back. My back still feels very fragile. I think if I I've done little hops on the spot, right, to see how it feels, and it doesn't. One day it might feel okay, the other day, next day it might feel super, super fragile, and I can't do that because it feels like it's just gonna snap, I guess. But I know it won't. It just feels that way. But I think it's all getting better. But I guess I'm 2 months post-op now, so if it's not getting better now, it's probably never going to. But there is light at the end of the tunnel. I'm hoping that by 6 months to a year, I could be back on my bike and I might be able to even consider going for runs. I've watched a few other people on YouTube who've had this say that they've been back running and they've been back cycling, and that's encouraging, to say the least. So, yeah, I guess I'll just have to wait and see how I'm going to heal, hope the infection's gone, and wait and see how the MRI looks at 6 months. I've got physio appointments every 4 weeks up until then, so, you know, if have a growth spurt and recovery at, 12 weeks, 15 weeks, then maybe I'll be back on the bike sooner. Anyway, hope everyone's doing okay, and goodbye.